Welcome to the HealthspanMD Podcast. Hi, I'm Dr. Robert Todd Hurst, and did you know the average lifespan is about 4,000 weeks? That's a number that will get your attention, but we also know that those who get into the top 5th percentile in longevity add an additional 10 to 14 years. On the HealthspanMD Podcast, our goal is to get you the best chance at that additional 10 to 14 years or more, and make longevity simple, to work smarter, not harder, and we do this in less than an hour. Today, we are going to sit down with Gianni Del Franco, the founder of BioElite, a premier personal training and fitness coaching service focused on helping clients achieve their peak potential. And we are going to talk about how personal trainers and physicians can collaborate to create comprehensive health strategies while also diving into the 3 essentials of longevity: building a strong body, maintaining a healthy brain, and getting high-quality proactive health care. That's Medicine 3.0 for those of you into longevity. Welcome to the HealthspanMD Podcast, Gianni.
Thank you very much. I'm happy to be on.
Yeah, it's a real honor to have you here. So, I heard many good things about you from multiple different places. I went on your website, and you've done a lot of work with high-end athletes, professional athletes, high-level endurance athletes in your career. What were the lessons you learned from working with these individuals that could, help you with us mere mortals?
So there's 2 different ways I want to kind of approach that question. The first one is mentality-based. A lot of high-performing athletes are very similar to high-performing individuals like doctors, lawyers, even down to teachers, coaches, where high performance in their mind is finding a way to become better in some respect, taking a look at where they currently are, where their current setbacks are, and finding ways to overcome those setbacks. So I love the mentality behind that piece. And we saw it every single day. Whenever they would mess up on an exercise, they're like, how can I do better on this? And we start giving them coaching cues. How do you respond to it? How do you grow from it? Do you have negative self-talk versus positive self-talk? So we started playing with those athletes, and even like the high school athletes that are trying to get to the next step up and go to college, where now they're beating out a mass amount of people to get there for money, for a scholarship, so that they don't have to worry about paying for their undergrad. It's massive. So the high performance isn't just like pro athletes. It's every spectrum of athletics that I saw it in. So the mentality side, phenomenal. Physicality, that was interesting. So I worked with high-performing individuals on the athletic side, but I transitioned into more of a corporate wellness type model where I worked with physical therapists really closely, taking people from pain and transitioning back to performance so they can go back to their workplace without any pain at all. And one of the things I noticed was the same movements, the same patterns, and the same things we needed to work on with these athletes that were in the professionals were the same movement patterns, the same things that we need to progress with a pretty good reduction in how someone moved, figuring out the same movement patterns and how do we train that to get them out of pain. Same type of movements. We just had to regress them.
Really, really interesting. So I love that concept. I think about that in medicine as well, is like identifying the constriction, like what's preventing you from getting to that, next step. And then let's focus on that. Like, how do we solve that constriction? And it sounds like that's similar to your approach to working with the athlete in all of us.
Yes, absolutely. That's why I like calling, everyone is the everyday athlete. We move around, we pick up kids, we do anything like that. We have to reach from different areas. People enjoy biking regularly, exercising regularly. We all have to have some type of athleticism in order to live a really healthy life.
Yeah. And I think that aligns also really well with my thoughts about, healthcare, about longevity. It's traditionally healthcare has been really reactive. Like, we'll wait until you get sick and then we'll pull out all the stops and, try to solve that problem and hope that we do, when there's so much opportunity to identify things beforehand that can optimize health. And physical activity, exercise, maybe the most powerful tool we have. I don't want to rank them because they're all unique to each individual. Like, for some people, their constriction, if you will, is their sleep. Like, they need to get the sleep better. Some is nutrition. But when you look at the power to improve metabolic health, mental health, the strength, avoiding being frail, like all those things we worry about in longevity, physical activity is really high, if not the highest thing.
It is
on there. How have you seen it, or how are you envisioning how doctors and exercise specialists like yourself can work collaboratively to help people achieve their health goals?
So the first thing that I want to kind of attack with that is where it currently is. And right now, with how medicine is normally talked about, I like to think about cardiology really commonly, is there's not a direct referral from the cardiologist to an exercise specialist. There's the option afterwards to go into cardiac rehab, but it's not a forceful thing. It's not something like, hey, you just had a stent put in, you need to go to cardiac rehab. It's we have this as an option for you. And that's mostly going to be on the side of health insurance and people being afraid of how much it's going to cost and everything.
We'll point out, in my practice, you're going to be strongly encouraged.
Yes. And that's the key thing. Yeah. And a lot of people are very restricted. If we take a look at the general population, they're restricted by cost. So a lot of the solutions are actually not very costly. You can do it at home. You could do it at a park. You don't need a ton of equipment. You just need to move. You need to be active. So having an understanding of what someone can do and bringing it down to something simple can make it more applicable to every single person. And that's where I think the kind of miscommunication lies.
Yeah, I just want to add on to that the amazing tool that cardiac rehab can be. We have data that those who participate in cardiac rehab, phase 2 cardiac rehab, is 36 one-hour sessions, generally over 12 weeks, although you can extend that period of time for people that meet certain diagnoses. They've had a stent, they've had a heart attack, they've had surgery, they have chronic stable angina, they have heart failure now as a paid-for diagnosis. And these people get to go in and spend an hour in this environment of wellness. It's people that are passionate about what they do. They're exercise physiologists, there's nurses, there's nutritionists, dietitians, all of these things, all centered around wellness. And there's research data that shows that there are people that participate in 36 sessions versus those who only went to one. There is a 50% decrease in mortality and death rates and about a third less recurrent heart attacks in that group. Now, that's not placebo-controlled randomized because there is some selection bias there. People that are going to do 36 sessions, probably more interested in their health than the person who is going to do one session. But I tell all my patients, do not miss this opportunity. And, even the ones that are reluctant, I say, just go once. Because if you go once, more often than not, people come back and say, you know what, I felt good.
Yes, and there's something really important to bring up with that. Is typically post any type of cardiac event, any type of surgery, there's going to be some type of anxiety. There's going to be some type of fear of bringing your heart rate back up. And if someone has a pacemaker in, there's another term called shock anxiety, where you're afraid of being shocked by the pacemaker if you start to become more active. So even if they were active prior to, they become fearful of raising their heart rate, when actually that's one of the best things you could possibly do after any type of cardiac event or surgery. So just the ability to overcome anxiety, which is just fear of what might happen in the future and then ruminating on what might happen in the future, you have to recognize what's important now.
Yeah, such great insight, and one that it's been so prominent in my practice. One, somebody goes through a cardiac issue. It's a psychological challenge for many people. They're facing their mortality. They've gone through scary procedures and a lot of fear and things. And being in an environment where other people have gone through similar, often worse than what you went through, that in itself has some reassurance, but also getting the confidence that you can go out and be active, because, that's often a real barrier for people that have had cardiac symptoms is, I don't know, can I go out and push myself? Can I go out and be safe? I'm like, here's your environment. Go. push yourself, do all the things, and then you can leave that saying, okay, I feel better. Like I can do these things. But there's even outside of known diagnoses that are paid for with cardiac rehab. There's not a medical condition that I'm thinking of that, from a cardiac standpoint, blood pressure, cholesterol, diabetes, metabolic syndrome, all of these things that can't be benefited by physical activity.
Yes.
Why are we not, working with you all the time? Like, why is that not happening?
A lot of people don't really connect with the understanding of what we do. And people think, personal trainers, they make you lift weights. Some people have been hurt going to some personal trainers, and that's just a reality of what the environment's like. So having a coach rather than a personal trainer, for some people, makes a big difference, where a coach is going to be understanding of current situations and honing in on what needs to happen, whereas the typical stigma behind personal training is they count your reps. They're sometimes going to be on your phone. Half of the session is going to be wasted because they just put you on a cardio machine and do what they want for half an hour before they come and grab you. There's a lot of different types of stigma behind the difference between a personal trainer and a strength coach. Both are remarkably important because they are the forefront of preventative medicine. Now, there's a difference that's kind of happening in our world where we're trying to get more personal trainers to understand the ways to kind of navigate injury and navigate chronic disease and how to have those conversations better.
That's a real. I want you to dive deeper into the distinction between a coach and a personal trainer. And along those lines, I also, from a personal standpoint, but a patient standpoint as well, have had some variable experiences with personal trainers. Like, at times it feels like, okay, this personal trainer, they love being in the gym for 19 hours a day, and they think everybody else does as well, and number two, if I'm able to get out of bed the next morning, they feel like they failed, and that of course leads to people, either hating it or they get injured, and then we've lost everything. You're describing a coach. Tell me how that is different than a personal trainer experience.
I'm a strength conditioning coach, and the way I was kind of brought up into this world in terms of my career was that I learned to be with the client 100%. It is much more of a mindset aspect of being a coach versus a personal trainer versus a specific terminology. So for me, it's actually a certification that makes me a strength coach. But if you think about any other type of business that relies on a coach, like a life coach or a business coach, what is the coach's job? They guide you to the next steps. They don't tell you what the next steps are, but they help you figure out what the important pieces are and what might be lacking, what the purpose behind it is, and what your purpose is for actually doing the thing, helping with the realization, and then getting you to the next phase. And that's the important piece, is once you get to the next phase, then what? You find out the next purpose. You find out the next pieces that are important.
That's brilliant. And you're exactly right. I've noticed that in my practice. And, what you may not know, our practice is a medical practice, but we have health coaches, we have a dietitian, we have an exercise physiologist. Like we pay we're really focused. Like, in fact, every patient in our practice they meet with a health coach on a monthly basis.
Brilliant.
And that's what I've learned about this. And in fairness to medical professionals all over the world, we're just not trained at these aspects. Like I got interested in this 20 years ago when I was a young cardiologist and realized, hey, just handing people prescriptions, I'm not affecting their health as much as I need to. How can I do better? And I've learned a lot about nutrition and physical activity, but more I've learned about behavior change, and there's a science behind that, and there's a way to go. And Dean Ornish has this great saying that I quote all the time. He says, people don't resist change, they resist being changed. What you're describing is that you're working collaboratively in partnership with them to help them achieve their goals. And anybody, I know this now, when a patient comes in and says, just tell me what to do, I know that's a non-starter. Like
Yep.
it's just because I tell them I don't know what you need to do because I don't know you yet. We need to work that out together, because if I just tell you what to do, chances of me getting it all right on the first is zero, right?
Exactly.
But if we start with okay, we're going to figure this out together. Here's my hypothesis. Here's what I'm suggesting. You're going to say, yes, that makes sense to me, or no, that does not. And then we build on the wins and we adjust from the setbacks. We're not going to fail.
Yep. Like, it's really easy for someone to come in and I say, listen, for you to improve your VO2 max, we need you to do at least 120 to 160 minutes of moderate to high intensity aerobic activity per week. But, okay, we have to take a step back and recognize what's their time availability.
Yeah.
What does the structure have to be like? How many days do they have to be like that? Because a lot of people work a career, they have kids, and they have a lot of time restraints. Is that amount of time going to be the most efficient use, or can we help them along the way by recognizing these small little steps that they need to take in order to get to the point to where their VO2 max is improving? But we don't need maximal. If you try and go max 100% of the time, the odds of you failing are going to be severely high. And our goal is very similar to anytime you change a habit. You're not going to be like from 0 to 5 days a week an hour and expect to stay at that 5 days a week an hour for the rest of your life. So if you say, hey, you know what? Maybe 2 days a week at 30 minutes is going to be the best to start. It's like, okay, some time freed up. I'm going to add a third day. It's like, yeah, let's add a third day.
Yeah.
What should I do on that third day? Well, let's plan something out.
So that's we talk about this a lot as well. It's working smarter, not harder.
Yes.
Right. So when you're trying to do it on your own, you're not really sure what makes sense, where your best opportunities are. You try to do the blunt force. I'm going to just bulldog through this, but you might be spending time doing things that not only don't accelerate your progress, it might even be a hindrance to that. But with an expert coach, you can get insights, guidance that says, oh, here's where. So in the end, you're saving time and you're minimizing injury risk, and you're doing the things that are actually going to get you there, and it's easier rather than harder.
Yeah.
Yeah. Beautiful. Yeah. So, I wanted to also do a deep dive. We talked about the 3 essentials of longevity. We say, that high quality proactive healthcare, maintaining a sharp mind, but building a strong body. And this is something that I be increasingly interested in being able to understand where people are, where their opportunities are, if they want longevity. Somebody will come to my office sometimes and their goal is they want to live to be 120. And I'm like, okay, I like your ambition. There's only one person in the history of the world that's lived there, but you know what? I'm all in on you. But I also, they're 10th percentile in muscle mass. They're nice, they're thin, but they're very low muscle mass, and I'm worried about those people from a frailty standpoint, because that's one of the things that happens as we get older is people lose muscle mass, they lose strength, they lose flexibility, they lose stability, and then they fall. And that fall is the devastating, like that's the broken hip, the injury of some sort that sets them on that downward spiral that is going to end their life. How do you think about this and that whole idea of maintaining a strong body for people that have longevity in mind? What's the things that you talk about your client or talk to your clients about?
So it all depends on where they're at. If they have never worked out before and they're starting to lose muscle and they're really worried and they start recognizing their bone mass is decreasing, it's like, oh, I really need to address this now. Then I always do a movement consultation to see how their body physically moves. We take a look at what we call movement patterns. How is the shape of the body moving so that we can prevent injury if you don't have any pain, or if you do have pain, the body will tell me how it's compensating so we can correct it. So that's typically the first step that I always look at, regardless of where someone is on their journey. But if someone's losing muscle mass and they're losing bone density and their strength is decreasing, I always start them just on resistance training. And I will never say that I am for free weights over machines or one versus the other, because they're tools. Everything in our world is a tool in order to achieve something. So we have to recognize what's important to that person. If I have an 80-year-old coming in that is worried about their bone density and they're starting to lose stability, I'm not going to have them do a single leg squat to a bench, because that's incredibly dangerous. I'm probably going to stick them on a leg press and leg extension and have them do single leg at a time so that they could build up the relative strength. And then we'll do recognizing movement patterns and see how their body's moving to see if they've built up the strength to now do a single leg squat free weight. So we'll progress into it. Another thing is when it comes to motor coordination. So there's movement patterns, certain shapes that we want to get into. And then motor coordination is how we can coordinate our upper and lower body to work together. So whenever you march or walk, opposite limbs move forward at the same time, right? Typical kind of gait analysis stuff. But a lot of people, when I ask them to march in place, they will go same side at the same time, right arm, right leg. And I call them movement monsters. Man, it's scary how many people cannot coordinate their body when we really need to dial that in. So we start moving in these really more natural ways so that we can teach how to apply force into the ground in a very safe and effective manner. We teach how to move in multiple directions so that if they have that risk of falling and they don't really know how to coordinate their feet and their upper body together, well, we just taught that. How do you move to the side? How do you cross over? How do you march forward? How do you go from a high surface to a low surface to a high surface? So there's different types of patterns that we can recognize in the everyday world and then train it inside of a weight room. So depending on where someone's at, we need to meet them there and then progress forward.
Two things that I love about this. Number one, it's the personalization, right? Like
Dramatically.
I always say this to patients. Anybody who comes with a one-size-fits-all model isn't likely. It's going to be just a guess if they're right for you. Anybody who's a clinician, which you clearly are, has been humbled by that. We all come with our biases, right? Like, everybody should be doing free weights or whatever. Yeah. But then when you get that into the real world and start testing it, you find out, okay, that's not a one size fits all.
And you find out real quick.
Exactly. And it's humbling, but it's an important thing to say, okay, I need to know about you so I can dial this in. The second thing is how important this is in avoiding injury.
Yes.
I tell my health coaches, I said the first 3 rules of physical activity: no injuries, no injuries, no injuries, because injuries are such a devastating blow for people. If you're behind the curve, many of us are, you're not as in good a shape as you want to be. You're not as strong. You're not as flexible, whatever that is. And then on top of that, you get injured. Man, that's a hard one to come back from.
Oh, yeah.
And this is a study that is really shocked me. They did a DEXA scan on people the day before they had hip surgery. So DEXA scan for body composition, not bone density, body composition, looked at muscle mass. And then they repeated the DEXA 4 days later after the surgery. They've been pretty immobile, right, for 4 days. The average muscle loss in 4 days was 3.2 pounds in an older population. Like you can imagine, like that's we cannot give that muscle away when we're 60s, 70s, 80s, and so that you can only imagine somebody who gets ill and they're in the hospital for 3 weeks, or they get an injury and they're laid up and can't get out of bed for 3 weeks. What the coming back from that, especially when you go into it with less reserves, and
it's gnarly.
It's just really brutal. So I love your approach, and that just makes so much sense to me as a doctor. How do you think about muscle in your patients that are, I guess, at all ages, the young ones, the middle-aged ones, the older ones, like where on that priority list for you is muscle and strength?
Muscle is the driving factor to almost everything that we see.
Yeah.
Hands down. And I'm saying that from a couple different purposes. Number one, we see that as muscle atrophies over time, you have an increased risk of injury, bone density loss, any type of neurocognitive problems start occurring is all pretty closely related to muscle mass loss. But when you start to take a look at strength versus muscle mass, more muscle mass can correlate to more strength, but more strength doesn't necessarily have to correlate with more muscle mass because it's a neuromuscular thing. It's how the nerves and the muscles talk. So we can build strength without necessarily building muscle because on some people's frames, there might be a maximum amount of muscle that a certain frame can have. So I like to take a look at it in two different types of factors just because of that. But if we think about strength innately, it's the ability's body to produce force. Or if I like to think of it in terms of plyometrics, how does the body absorb force? So if someone, let's say, trips, how do they catch themselves? Are they able to react and plant their foot and catch themselves? Are they able to get their arms up in an appropriate fashion to roll out of the trip? Are they able to react and get into the right position so that they don't injure themselves? Or if they have more muscle mass, the muscle, and not just bone density, but the volume of muscle is what we call like the protector of the body. So the more muscle you have, the less prone you are from getting injured because now you have a little cushion for the fall or something to help keep you together. So dislocations are harder. Any type of breaks, fractures are more difficult unless it's a very, very high impact issue.
Yeah. Yeah, it's interesting when you look at the literature about, strength and muscle mass and how they are predictive of health outcomes, both really strongly correlated with health outcomes. Strength more so, though.
Strength more so.
And it's because it's a functional assessment. It's not as easy to measure as muscle mass is, but, I think that's exactly what your experience is.
Yes, and this is why I think it was a publication from 2016. I don't remember who the author is, so please don't quote me on this. But grip strength. They found a really high correlation between grip strength and longevity because of how the central nervous system is able to react. Grip strength, because of all the nerves that integrate into the hands and throughout the forearms, you have to have a really good responsive nervous system to have good grip strength. And if you have someone that cannot open a jar and they have really low grip strength, the odds of them having a shorter health span, not just lifespan, because medicine is amazing nowadays, a shorter health span is probably due to how the nervous system's able to recover.
Yeah, we actually got the device to measure grip strength in our practice.
Yeah, that dynamometer.
The same reason. And I have to admit it was something I had to come to because I'm like, it's just measuring this one little thing. Like, how valuable could that be? But the more I learned about it, I'm like, wow, this integrates a lot of things into one simple measurement. And so, and it's been enlightening on some people. Like, some people are a lot less strong with their grip strength than I would have expected, and vice versa for that. So, that I think that's really great insight. The third essential of longevity that we talked about is maintaining a sharp mind or a healthy brain, and exercise is really critical for that as well. Can you talk a little bit about your experience in that and how I don't know, physical activity sometimes is the best therapies for mental health issues.
I'm going to go extreme on this one just because I want to bring some type of relational idea to this. So cerebellar ataxia is what happens when over time something might be wrong with the person where the cerebellum starts to shrink. It starts degrading, neurons start dying off, and the cerebellum shrinks in size. So motor pattern starts going away. They're not able to walk efficiently. Maybe they have a chronic cough because it affects a different type of component that the cerebellum is responsible for. And it's mostly like the motor cortex of the body, right? So if someone with cerebellar ataxia starts to train specifically towards patterns that their body's not used to, then we can see different parts of the brain being used in order to create movement instead of the cerebellum. So, and there's other, like in some third world countries, some tribes where they were born without a cerebellum, they were trying to figure out like what area of the brain they're using as the motor cortex, and it's typically the frontal lobe. A lot of like memory recognition and how things work in terms of a recall system, they start using more so instead. So when we take a look at how exercise can affect sharpness outside of just the neurochemical component and endorphins and stuff like that, we can actually start bringing back, I think it's neuroneogenesis is the term for it. We can start to grow back some of those neurons or train different parts of the brain to be utilized for motor capacity instead.
It's such a remarkable thing and really
wild.
Exciting. You know, a good friend of both of ours, we've had on the podcast, Dr. Amber Enright, who's a physical therapist who specializes in people with neurodegenerative disease. And she shows a video of a gentleman that she started working with Lewy body dementia. So Lewy body dementia, you know, is just a terrible, quickly progressive disease. And, you know, really no cure, no real treatments. And she shows this gentleman walking when she first met him, and it looked like Frankenstein walk, like barely, very unstable, you know, very jerky. It looks like a fall waiting to happen. And then she shows a video, you know, weeks, months later, I don't remember the time frame of it, but the guy is skipping and he's walking backwards faster than I can, and it was all work with Dr. Enright. And I'm like, how could that have been? How did you do that? And it's exactly what you've been talking about here.
Yep. It's all about teaching motor patterns. How does the body functionally move in multiple directions?
That's amazing. So I do want to take a step into more of a practical direction for people. And one of the things I've recognized when I first started learning about behavior change is the importance of habits. You know, habits it sounds boring. Everyone's habits, but really, you know, there's a saying like, you determine your habits and your habits determine you. There's not a truer statement that I can think of in health and wellness. And I notice on your information, you talk a lot about habits. Can you give us your framework for habits and how you help people develop the ones that will be consistent with their health goals?
Yes. I'll give a really good example that was also, I kind of heard it from another doctor, Dr. Michael Gervais, from one of his podcasts. I do something very similar where a habit is something that is typically pretty difficult for someone to develop. So we have to figure out what the primary barrier is to do it. And a lot of people, for exercise, it's going to be time related. So I don't want to wake up early to go exercise, but that's the only time I have. It's like, okay, maybe the best thing is the night before you take out your shoes and you put it next to the door. Cool. You got up, you did that action. Awesome. If that becomes easier for you, then maybe the next morning you go and you put the shoes on. Maybe you didn't go, but you put the shoes on. You made the effort to wake up and do the thing. Sweet. Now, since you've done it, it's like, okay, maybe I can get to my car, start the car. So now you're taking these small progressive steps, and then all of a sudden you wind up driving to the gym. Or if it's putting on the shoes and you have something at home, like if you have a yoga mat, maybe a couple dumbbells or kettlebells at home, you just start doing 5 minutes, 10 minutes, and you slowly progress and increase it. That's the best way to build a habit, is small bits over time. Little bite-sized chunks until it becomes a really easy, recognizable habit that you just do.
I had to learn this myself. So, you know, through medical training, you're working 80, 100 hours a week. I ate 100% highly processed foods, zero exercise, like none, you know, maybe running up a flight of stairs for a code or something like that. Yeah, my health was terrible. Luckily, I was younger, so I was able to get away with a lot of that. But then when I finished my training and I'm like, okay, I need to get active again, because I played a lot of sports when I was younger. I never really exercised. I just played sports. So now I'm like, I got to figure this out. And I kept going out too hard, too much, like, oh, well, I got to go to an hour. I got to spend an hour in the gym. Well, I don't have an hour. I won't even go then. I only have 40 minutes today. I won't go.
Exactly.
But I listening to that, the Tiny Habits guy, I can't remember his name, from San Francisco, James Clear, Atomic Habits, those, I started learning more about, how habits are developed. And I started with exactly what you said, is that I lay out my running shoes the night before with my running outfit. And I said, okay, that just set in my mind the expectation that I would do it. And then I still remember this to this day. I was post-call. I hadn't slept all night. Those are always days where I could say, I can't exercise today. I didn't get any sleep last night. I've been up for 30 hours, all these things. But I said, okay, today all I'm going to do is go around the block. And I'm going to run it slowly, like it'll be embarrassing. Like people will think that I'm a 90-year-old man going around the block, but I'm going to go really slow, but I'm going to go around the block and I'm going to do it. And I had so much more energy that day. And that day, it finally clicked. And I said, okay. And I started slow, and I, ended up more building up to being able to run and, do a hour-long run and those things. Yes. But I had to do it that approach.
And you said something really important that I want to bring up. You put the intention and the purpose forward. Yeah. You didn't just go out and set your shoes up and be like, yeah, I might do this tomorrow. It's like, no, I'm going to do this tomorrow morning. Yeah. I am having the intention to do the thing.
We don't like to be inconsistent with our decisions, right? Yeah. We want to, once we've made the commitment, we don't like to go against that. That's hard for
Cognitive
us.
dissonance.
There you go. Now we're using the big words. All right.
Love my big words.
Just so tell us a little bit about your company, BioElite. Like, first of all, that's a really cool name.
Thank you.
Very, very cool. Where did it come from, and who are the people that you serve?
So the name BioElite and BioElite Training Systems is basically based off of the fact that every single person is their own individual, which means we can make you as great as you personally want to be. We have to fit to your biology. So even my logo, it's an individual with their arms out like this, which is funny because my wife, Mackenzie, any trip that she does, she always poses with her arms out and her fingers up. Yeah. And the person that I hired to design the logo had no idea. And she designed that logo, and it looked just like my wife. And I was like, oh, this is way too perfect. Yeah. It was fate. Yeah. It was amazing. So the people that we kind of serve is anyone that is ready to pull the trigger on getting healthier. So we can serve on a lot of different aspects. We do in-person, or what I call a hybrid style, to where we recognize that you might not be able to see us every single day for the type of protocol that we would want. So I like to see people maybe once or twice a week in person. And then I create small little bite-sized pieces that you could take home. We also do habit coaching, and we do some nutritional coaching to where we help people recognize what portion sizes are or anything like that, but we're not registered dietitians. We don't write meal plans, nothing like that. Right. It's just the foundations of nutrition, and we teach how to develop habits and give good exercise structure based on where you're at. If you have pain, we can help you out of pain, especially if it's chronic, not acute. So we are not physical therapists, and we don't work in that capacity, but we partner with physical therapists to make sure you can get where you want to get. So we like to coordinate healthcare as well. We want to make sure that you get the best possible treatment.
What an amazing, vision you have and purpose that you're serving there. One thing that comes up a lot for me, and I just want your thoughts on this, although I'm pretty sure I know where you'll go. I'll have people come to me and they're worried it's too late for them. I've had men in their 50s say, well, I heard on Peter Attia that if you don't have 90th percentile muscle mass by 40, you're screwed. Or, or more likely people in their 70s, 80s, 90s, the joke is, well, if I knew I was going to live this long, I would have taken better care of myself. But what do I do now? What's your response to somebody that says, is it too late?
There is no such thing as too late. I know someone that didn't work out a day in their life, and they were 72 years old, and they're like, I have pain, just had PRP done in the hip, and have no idea what to do now, but I was referred to come over to you because I heard strength might be the next thing. I'm like, 100%. We need to build you some muscle, we need to build some strength, and we need to teach your body how it just needs to move. And her muscle mass increased by 5 pounds in 3 months. which is amazing because we didn't even take a look at nutrition. It's just something her body has not done before, and the body responds. So when you take the right actions, no matter how big or small they are, you take the right actions, the body will respond. It doesn't matter how old you are. It doesn't matter how young you are. If you're 8 years old, you can start exercising outside of just sports. There's other things that you can do.
That's the thing that I've learned in my practice. So we do DEXA for body composition in our practice. And, coming into that, I'm a doctor. I'm not a exercise specialist, but you hear the kind of the mantra that, well, after a certain age, adding muscle is, almost impossible. Or as we get older, it's inevitable that we're going to lose, muscle and strength and these things. And, but I also well, is that because, are we losing muscle because we got older, or are we losing muscle because we're not as active as we used to be? And I will tell you unequivocally, I know now what that answer is. And it's that, adding muscle after a certain age, no doubt about it, you can do that. I'll give you two examples, two of them. Almost as remarkable as yours. I mean, 5 pounds of muscle. Early people get, amazing results, when they haven't done things. This is really cool. But one was a man in his early 70s. He's pretty dialed in on his longevity. This is his job now. He's was a highly successful guy. Now he's retired from his business, but now he's dedicating his time to longevity. And so he's got a personal trainer that comes to his home every day. He's investing a lot, time and money, resources into this. But he had a DEXA 6 months apart. And in that DEXA, he lost 6.5 pounds of fat and gained 8 pounds of muscle in 6 months at 71 years of age. That's, I looked at it 100 times. I'm like, God, is this even real? And then he pointed out to me that the fat content in his head, because it gives you that on the report, was to the gram, the exact number as it was on the previous scan. And I'm like, okay, that's a pretty good, that was a pretty good barometer. But another guy that I really love this story, he's 93. Comes in to see me. He's not doing any exercise, but he says, hey, I heard about your practice. Would you work with me? And I'm like, sure, of course. So he starts working with the health coaches, just started even with some walking, building up a little bit. He then making sure he's getting his protein intake, and then they started some lightweight things. But he says, I want a DEXA every 3 months because I'm 93 years old. I can't wait around and see if it's going to work, right? I need to be moving on this. And I'm like, okay, well, we'll do that. He gets another DEXA 3 months later. At 93 years of age, he lost 1.2% of his body fat, and he gained 2 pounds of muscle at 93 without a big intervention. It wasn't like we were training this guy hours a day or anything, nothing even close to that. So I don't know. I found both of those stories so inspiring to me because, I'm 58 years old, and there's been times when I'm like, man, I wish I would have paid more attention when I was younger. I was, I wish I did more strength training. I wish I had more muscle. I'm realizing that the time is now. There's a lot of opportunity, and it sounds like that's your experience as well.
100%.
Yeah, beautiful. Well, Gianni, it's been a real pleasure, man. The time just has flown by with us here. Give our audience, I know they're going to be really excited about, learning more about you and connecting. How do they learn more about you, BioElite, and how do they make a connection with you?
So the easiest way to make a connection is to go, to my Instagram. It's just my name, Gianni_Del Franco. Or you can go to our website, BioElite, so BeBioElite.com. Easiest places to find us.
Thank you for joining us.
My pleasure. It was awesome. Thank you, Dr. Hurst.
All content created by me and HealthspanMD is for general informational purposes only and is not the practice of medicine. No doctor-patient relationship is formed. The use of this information is at the user's own risk and is not a substitute for professional medical advice, diagnosis, or treatment. Hi, I'm Dr. Hurst. We created HealthspanMD for people who are dissatisfied with healthcare. Common complaints about healthcare include difficult access, poor communication, rushed appointments, disease-focused or sick care with little interest in helping people get or stay healthy, and little to offer beyond a prescription or procedure for optimizing health. This type of healthcare is unacceptable. but most aren't aware that they don't have to accept low-quality health care. HealthspanMD provides exceptional medical care. That means appointments when you need them, time to talk to your doctor, get your questions answered, understand your problems, and get a clear plan to achieving your health goals. But it also means a comprehensive, proactive approach to your health that goes beyond prescriptions and procedures. As a HealthspanMD patient, you will get our expert, physician-led team of doctors, health coaches, dietitians, exercise specialists, mental health, and other health professionals to help you take advantage of your best opportunities to prevent, treat, and even reverse disease. And you may be eligible to have our care model reimbursed by Medicare and some commercial insurance. If you're no longer willing to settle for low-quality health care, schedule an appointment at HealthspanMD to experience health care as it should be.